And welcome back. It's time for Medical Monday with East Cooper Medical Center. East Cooper, you know, is the ABC News 4 hospital expert. And today we're talking about the signs and symptoms of asthma. The scary thing is you may not even know that you have it. And Dr. Barbara Allen McGarrett joins us now with more. Thank you for joining us this morning.
Thank you for having
And I think
me.
this is a very near and dear topic for myself because I do have a couple of dear people in my life who suffer from asthma. But how can you tell a normal breathing problem if someone just gets winded? So like if you have a child and, you know, they're athletic and they're doing certain things like that and they're complaining about not being able to get in enough air. What are some of the signs and symptoms of asthma?
Well, they could be kind of insidious, but a lot of people, the worst thing would be wheezing, of course. A lot of people may just have a dry cough. And as you mentioned, when people do a little bit of exercise or laughter, they may start coughing or they may even start wheezing or they just feel that their breath is short, particularly if they're doing some kind of exercise.
Now here's a side question really. Can people develop asthma as they get older, or is it something that they're born with?
No, we now know that people who've never had asthma as a child or even as a young adult can develop asthma. We have this thing called occupational asthma. The other thing that's in the news right now, at least in our literature, is that someone could get sick with a really bad viral infection or part of a bacterial and viral infection, and that could cause them to have signs and symptoms of asthma when they really don't have true asthma.
Okay.
But while they're healing, they could be having the symptoms.
Now for those that you say have the true asthma, what causes that?
We now know that it's a genetic propendency, and it's really more if the mother has allergies or the father has allergies, but it's almost a genetic programmed disease. And we now know that environmental things can make it worse, either allergens or pollen, viruses, also even some smog and fog in some very, very bad areas of the country.
Now here's another question. Is there a way, let's say, I guess it's because I have children, that parents, if they suspect maybe that their child might be asthmatic, are there tests that are done to find this out? Or?
Yeah, there are tests to find out if people have allergic asthma or allergy. We can also tell if people have other asthma. There's a tendency not to diagnose asthma in children that are 4 to 5, even though they have it. We would probably treat it the same way as asthma, calling it reactive airway disease. But certainly the idea of allergens, particularly in the low country, and getting tested.
Yeah.
Either
Now,
skin testing or blood testing.
Oh, okay. Now, here's another question for you. How is asthma treated? I know they have the inhalers. I know some people have had to take breathing treatments along the way. How far have we come when it comes to treatment for asthma?
Well, the drugs that are available right now are excellent. And so we do have inhalers that are rescue inhalers. If a person can't do the rescue inhaler, they can have a nebulizer like a young child. And we also have people on maintenance medication, either steroid inhalers, also another drug that's out there is called Singulair. It works in a different fashion, but you'd always like to control their upper airways, their what we call hay fever, allergic rhinitis.
Now, what do you think about over-the-counter asthma medications?
They're great, and you know the problem is this though, a lot of people tend to self-medicate and they may not know what their diagnosis is.
So that because you're given a certain dosage for your level of asthma. And what about allergy shots?
Allergy shots do work. The problem is that we don't know predictive value of who they're going to work on. But certainly if someone sees an allergist, has the signs and symptoms, either has a lot of problems or has very severe disease or doesn't want to keep taking medicines every day, allergy shots are an option for them.
And of course, if they have any concerns or if they've never been diagnosed before, but they suspect that they may have it or their child may have it, of course, they should come see you guys at East Cooper Medical, right?
And we certainly appreciate it. See an allergist, get tested, get treated.
All right, Dr. McGarrett, thank you so much for joining us. Some great information this morning.
Thank you, ma'am.
All right, take care. And remember, you can find this information and more. Just visit our experts page at abcnews4.com/experts. We'll be right back.
Thanks very much.